Okay, so here we'll be discussing about ventricular hypertrophy. Okay, right ventricular hypertrophy versus left ventricular hypertrophy. This will be discussing here, right? So talking about your see, this is your normal. Okay, where both the ventricles are normal size, and this is what you get in your V1 V2, and this is you get in V5 V6. All right, normal. Now when there is left ventricular hypertrophy, where there is the left ventricle has enlarged, there is hypertrophy of the left ventricle. Of course the axis will be shifted now to the left side, definitely, right? So there will be few changes, right? So we will see these changes. And when there is right ventricular hypertrophy, the right side of the ventricle is now enlarged, the axis will be shifted towards the right side of the heart, and we will see some changes. Now we will discuss what changes we will see and where we will see, and let's discuss about each and every points, right? So first I will take your left ventricular hypertrophy. So what is there? That is the this is your left side of the heart. The left ventricle is hypertrophied here. So the left ventricle hypertrophied, so the entire cardiac axis will now be shifted towards the left side. This is clear, right? So now what will be the ECG findings? In the bundle branch section, I already mentioned that the chest leads are placed on the sternum of the from the sternum, right? If this is your body, this is your sternum, then from V1 to V6, this is placed like this way. So V1 and V2 comes near to the sternum, V5 is in the lateral side. All right. This is how we place. In the right side we place lead 1, left side lead 2, and ABF like that. Okay, so anyway, just a brief understanding, right? Now see what are the changes we will see in case of left ventricular hypertrophy, where there is a hypertrophy of your left ventricle, right? So first of all, there will be increased left ventricle voltages. You agree with this? I guess yes, because the left ventricle is now increased. There is a huge precordial R and S wave that overlap with the adjacent leads. So remember, in left ventricular hypertrophy, what we are going to see in lead V2, and in lead V6, something and something, if we add, it will be more than 35 millimeter, and if it is more than 35 millimeter, it will suggest to have left ventricular hypertrophy. This is a calculation just. So remember, the S wave in V2 and R wave in V6, if both the calculation comes more than 35 millimeter, it is suggestive of left ventricular hypertrophy. Okay, this is the easy and simplest way how you can identify. And of course there will be left axis deviation, but that you cannot identify easily. This one you can easily calculate and find it out. Now this is what I told, and just remember that LVH is S wave in V2 plus R wave in V6 or V5, whatever you say, more than or equal to 35 millimeter. Okay, I think this is clear, right? Now again, there may be other changes like ST depression or T inversion in lateral leads, but okay, that's fine. Talking about RVH, right ventricular hypertrophy, there will be of course right axis deviation. You know that there will be right axis deviation. Okay, there will be dominant R wave in V1 and dominant S wave in V6. Now here what will you see? Simple things, just remember that here you will see that R wave in V1, if it is more than 7 millimeter tall, or S wave in V6 more than 7 millimeter deep, right? There it is going in the favor of RVH, right? Also here you can find some ST depression, T inversion, but in V1 to V4, of course, because it is right ventricular hypertrophy, right? So the leads that are placed more on the right side, that is your V1 to V4, will be, you know, suggestive and more important, right? So here we will find the V1 and V6 leads. So R wave in V1 if more than 7 millimeter, or S wave in V6 is more than 7 millimeter deep, correct? This is tall and this is deep, right? So this is suggestive of right ventricular hypertrophy. Now we will see some causes of both. So here I am making a table of right ventricular hypertrophy, left ventricular hypertrophy. Here I am writing the causes, and this is an important slide. All right. So talking about the right ventricular hypertrophy, the causes being most important cause is a pulmonary hypertension, correct? Then is your mitral stenosis, pulmonary embolism, chronic lung disease, arrhythmogenic ventricular cardiomyopathy, congenital heart disease. Correct. Chronic lung disease, congenital heart disease, pulmonary embolism, mitral stenosis, pulmonary hypertension. All are conditions associated with right ventricular hypertrophy. Important risk factors. If I talk about causes of right ventricular hypertrophy, important one being hypertension, aortic stenosis, aortic regurgitation, mitral regurgitation, coarctation of aorta, and hypertrophic cardiac myopathy. Hypertension, aortic stenosis, aortic regurgitation, mitral regurgitation, coarctation of aorta, hypertrophic cardiac myopathy. All these being the causes of right ventricular hypertrophy. Now, let's come back to the ECG tracings. See, this is your left ventricular hypertrophy. What you will see that this one S wave in V2 you will calculate, and R wave in B5 or B6, whatever, say B6, you will calculate when it should be more than 35 millimeter. One box is 1 millimeter, alright. So that we will calculate is easy, and this suggests a left ventricular hypertrophy. Now in case of right ventricular hypertrophy, simple. You will calculate R wave in V1 whether it is more than 7 millimeter tall, or S wave in V6 whether it is more than 7 millimeter deep. Correct. Easy calculation, and if it is like that, then it's suggestive of right ventricular hypertrophy. This is suggestive of left ventricular hypertrophy. I think that's easy, right? There are alternative criteria as well, but I think I have mentioned the easiest possible way by what you can, by looking at the scenarios, by looking at the question, by identifying the causes, and then if you see the graph and you can just calculate out just the number of boxes and just add it up, then you can reach to the conclusion what type of hypertrophy it is, right? Okay.